Hi everyone. Good afternoon. I'm Dr. Edwin Guerrero, a board certified bariatric surgeon. Many of you already know me. And today we are going to talk about a very important topic about bariatric anesthesia. And we are with our bariatric anesthesiologist that also many of you already know, Doctora Gabriela Arceo. She's a specialist, and we want to explain many of your doubts and questions because, of course, this is a very important part of the weight loss process. The operating room is a place where you never it is not common to be there, so of course that it is common and normal to be afraid or to feel some fear, and that's why we decide to talk about anesthesia. And well, we are here with Doctora Gabriela Arceo.
Hi, good afternoon, everyone. I'm Dr. Gabriela Arceo, anesthesiologist, certified anesthesiologist. I have had about 16 years working like an anesthesiologist and almost 10 years were helping patients for the bariatric surgery. Okay, I want to apologize because yesterday I couldn't make it, but thank God we're here. And I want to thank Dr. Edwin Guerrero, muchas gracias, for inviting me to do this live because it's very important so we can solve your questions and make people feel safe, okay? And not be afraid of the anesthesia. So if you have any questions, please, we will help you we will answer the questions, and we're here, okay, to explain everything about it.
Okay, thank you, doctora. So the first question, I think that it is one of the most that patients ask me, is about is this real that I could not wake up from anesthesia?
Well, that's a very frequent, a very common question. Okay, I think most of our patients they're about when they came to the surgery. What they told me is that they're most afraid of the anesthesia than the surgery. Okay, so it's a common question, but well, I can tell you that today the anesthesia has very it's very it's not common that the patient don't be awake from the anesthesia because we have a lot of devices that help us to check how the anesthesia is working during the surgery. Okay, so besides all the monitor that we are checking, like high blood pressure, oxygen, heartbeat, we can use also another modern devices like the brain, how it's working the brain with the anesthesia, and also how the patient if the patient is feeling pain even with under anesthesia. So today it's not common and it's not frequent that the patient could not wake up with the anesthesia. So it's not frequent that the patients been sleep during all the surgery and after the surgery. Sorry. So you can be sure that you're gonna wake up after the procedure.
Yes, thank you, and yeah, I agree because there are a lot of trials and that shows how advanced is anesthesia to decrease the risk. And the next question is about another question that my patients ask me is about how does your team reduce the risks of anesthesia?
Well, first of all, when the patient reaches, they have a questionnaire that they have to answer, so we know if the patient have any disease, medication they're using, any drug use, if they smoke. So checking the question and all the answers they make, we can individualize the treatment that the patient will need. Okay, and we have to do some recommendations to every patient to make the anesthesia more safe. Okay, so it's important that we as a team we help the patient, okay, to make him get to the operation room in the best way. Okay, so it's very important that the patient sets everything that he has, like a disease, medication they're using, and so that's a way that we can decrease the risk under anesthesia. Okay, we are a great team. Okay, here. So how can I say it? But well, people can feel safe with us. That's why it's important that the patient ask anything that they have, so we can help them to reduce the risk.
Yeah, thank you, and as you said, there are many times when the patients contact us. For example, the first contact is with a coordinator, maybe when they are asking for information, and then the patients have a video call appointment with me, a bariatric surgeon. Before the consultation, we ask to all patients to fill out a health questionnaire. That way, we could know everything about the medical history of all patients, as Dr. Arceo says. And depending of the medical history, we will give to the patients the recommendations. Each patient is different, so that's why we must individualize each patient. And then once patient arrive at the hospital, they will have the contact with the bariatric physician, and then Dr. Arceo always visit all patients before the surgery to confirm that everything is well and that the pre-op protocol is complete. So thank you for answering this question.
Okay.
And okay, another important question is, how do you decide which type of anesthesia is safest for each patient?
Well, as I said before, we have to individualize every patient. Okay, but with a laparoscopic surgery, it's very important to maintain the patient unconscious, relax, and the most recommend anesthesia is a general anesthesia. Okay, for bariatric surgery. And well, we have to, as I told you, individualize the dose of anesthesia that each patient needs. And of course, if the patient has a high blood pressure or diabetes or any sleep apnea, we have to take care also of each disease, right? So it's not that anesthesia is the same anesthesia to every patient. That's what I'm trying to say. So, but with the laparoscopic anesthesia, that is the laparoscopic surgery, It's the general anesthesia, the one that we use with all the patients. We have to take care of the airway. Okay, that's the more important. And the patient has to be unconscious, okay, during the surgery. So that's why the general anesthesia is the most recommended for this kind of surgery.
Thank you. And yes, we always use general anesthesia for bariatric surgery because we perform uh, bariatric surgery by laparoscopy. And as Dr. Arceo, she is the specialist in anesthesia. We use general anesthesia, but this is something that we know because we are the specialist and we work with. But someone who is asking and investigating about everything. So this is the answer why we use general anesthesia, because for the bariatric surgery is the safest one. In other kind of surgeries, well, maybe would be different, but as Doctora explained us, they individualize each patient. Okay, thank you. And next question is, what role does the multidisciplinary team play in keeping me safe during, well, before, during, and after my surgery?
Okay, the multidisciplinary group, it's very important because well, we're having a great team, and all of us, we're commit and involved to make your surgery safest and to make your surgery successful. It's very important that each of us work in touch when we see that any patient have a different needs. So when I have a patient with diabetes or high blood pressure, I can contact the medical internist, so he can tell me that how the patient is doing, because of course the medical internist also check the patient before the surgery. So we always stay in touch every day with each patient, so we can make a great plan to make the surgery successful. And well, we are a lot of people, okay, we're working with the patient, so it's very important that we are great communication. That's why it's very important to have a multidisciplinary work group, so the patient can feel comfortable, can feel with less fear, and you can be sure that each one of us, we're gonna do this the best to make you feel good and to take care of you, that everything goes fine with your surgery.
Thank you, and yes, remember that this is a process. It's not about surgery. Surgery is a part of the process, but the process starts when you decide to have a better life. In this case, health by surgery, and that's why when you communicate with us, we all start with the process. And as Doctora explained, we are a big team, and we all are certified specialists, and we are in communication. The first contact with a medical coordinator or with me, if there are something that we should know, we communicate with the internist physician, even with Doctora Arceo, to confirm that everything is well before surgery. Even on your surgery day, once you arrive, we will perform blood work and EKG, and then the internist physician or intensivist physician will go with you and will ask you some questions, and we'll check all the blood work results and the EKG, and will give us all the recommendations to decrease the risk of surgery and after surgery. And of course, anesthesiologist always visit you even before surgery. This is before surgery. During surgery, well, Doctora Arceo is a specialist in maintaining everything well while we are performing the surgery. We are working together, of course. And after surgery, we have in our team medical coordinator, and bariatric physician and nurses, and we all are checking up on you to confirm that everything is going well. And we have one question in the comments. Hi, Christy, how are you? Thank you for watching us. She says, I'm scared of the dumping syndrome, doctors. Okay, this is a good question, and a dumping syndrome. It is a it could it is not very common, but it can happen. But of course, we can treat it first with recommendations about eating habits, medication, and in the last option would be surgery, depending of the patient. It is more common in the gastric bypass more than the sleeve. In the sleeve, it is not common. It could happen, but it is not common. And even in the gastric bypass, it is not very common, but it could happen. But while you follow all the recommendations about diet and about medication in case of, that risk of dumping syndrome is very low. Majority of the patients who develop dumping syndrome resolves or are treated with medication, not with surgery. With surgery, and everything is well. So it is not very common, but it could happen, and it is more common in the gastric bypass more than the sleep. So thank you for asking. And Violeta, best theme ever. Thank you, Violeta.
Thank
Thank
you.
you.
Hi.
Yeah, very patient too. Congratulations for your weight loss. Yeah.
Yes, of
Okay.
course.
And we will continue with another question, a very important question. Are there warning signs or health conditions that increase anesthesia risks, and how do you prepare for them?
Well, yes, of course. They're very, like as I told you, they're disease that can make, we call them like a risk for the surgery, for the anesthesia. If the patient is not well controlled with with their blood pressure, with diabetes, with sleep apnea, those are very risk factors that can make a complicate to have a complications. Okay, so it's very important that the patient gets to the hospital with their medication. Okay, with a great a great treatment of their disease. And also it's important to stay close to all the recommendations that we make before the surgery. Okay, like don't not smoking, not drugs. What else? If you have sleep apnea, try to use the CPAP. What else? Also to bring to the hospital all your medications they used to take. That's very important for us. Okay, and well, the anesthesia, it's the modern anesthesia is highly advanced. So if you're not well treatment for your disease, we can have medications during the surgery that can help you to maintain stable. Okay, so but anyway, you have to help us a little bit with your medications. And as I tell you, we have to individualize each patient, and what we do is adjust the type or dose of anesthesia to every patient, okay, that it needs. So please try to stay to help us with the recommendations that we made you to have a great surgery and successful surgery. So that's important. Okay, so That's you can be sure that if we have any problems during this anesthesia, we're gonna solve them. As I told you, we monitorize during all the surgery to the patients, and each 5 or 3 minutes we are checking if we're having any problems, and we can solve them. Okay, so all the anesthesiologists are prepared to solve the problems during the surgery. So you can be sure that we will treat you the best if we have a little problem during the surgery. And so it's important to maintain control with all your diseases. That's the point. Like, and also please don't smoke. If we ask you to fast before the surgery, please do it. Okay, that's very, very important, because with the solids you have to fast at about 6 or 8 hours, and with liquids, with clear liquids, at about 2 hours before the surgery. It's very important to avoid an aspiration during the anesthesia. Aspiration, that means that the meal or the liquid can go to your lungs, and then that's a complication that we don't want to have. Okay, so please, the goal here is that all the patient be follow all the recommendations to make a safest anesthesia, a safest surgery.
Thank you. I think you have told us very, very important tips. And
Yes.
another very common question and that is about the fasting. And because
Yeah.
sometimes patients think or they don't know that fasting means not even liquids. And so fasting do not drink not only food, also no liquids.
Yes.
And another very common, I think that one of the most common comorbidities is high blood pressure. And sometimes patient ask us, doctor, should I take the blood pressure medication the surgery day, or when should I stop taking the blood pressure medication? And what is your recommendation?
Well, they have to take their medications even the day of the surgery. Okay, if they used to take their medication once a day or twice a day, at the morning and then at night, they have to still take their medication as they used to, so the blood pressure stays stable. Because that's very important, because when they get to the hospital, the patient comes uh, with a little stress. That's very normal. And if they don't take their pills for the high blood pressure, with the stress and without their pills, they can, of course, the blood pressure can get higher. So uh, sometimes if they get to the hospital with a high blood pressure, we can suspend the surgery. Okay, until they have a normal blood pressure. So please keep taking your medication of the blood pressure as you used to. Okay, please don't suspend it. It will help you and it will help us.
Yeah, thank you. And in the comments, Gloria says, hola, hola, Gloria,
Hola, hola.
Ashley, saludos, saludos.
Gloria.
And Carla says, saludos a un gran equipo de profesionales de la salud que le
Gracias.
tengo una gran confianza. Thank you. Muchas gracias, Carla. Thank you very
Gracias,
much, Carla.
Carla.
Gracias por tu confianza.
Sí.
Y bueno, would you like to add something? We will be having more sessions, maybe another topics of anesthesia, because I
Yes.
think that it is a big topic, and there are many important things that we would like to inform. I think that well, our goal for you is for our patients is to feel informed and safe. And I think that when we understand what's myth and what's real, anxiety decreases,
Yes.
and recovery improves. So that's our objective, to help you, to explain you about some questions, and that's. And thank you all for joining us. You know that if you have any other questions, you can send us a message. We will be happy to guide you, to support you, and we all are a big team. And thank you, Doctora Arceo, for explaining us. You are
Thank
the
you.
specialist. You are the best in bariatric anesthesiologist, and a very important key of this team. And thank you everyone for joining us this afternoon.
Okay. Thank you so much. Thank you, Dr. Edwin, for inviting me to this live. And thanks to everyone that are here with us. We will try to talk more about more things about anesthesia. I know that everyone has a lot of questions. And just to finish, and tell you that anesthesia is generally very safe at this time, because with the modern techniques and the modern monitoring that we have, we can be sure that the patient is safe, their brain is safe, their heart is safe. So, and really, you can be sure that you will not gonna stay. You're not gonna have problems to wake from the anesthesia, because we also have medications to reverse the anesthesics. So we will keep continuing with these sessions. And thank you, everyone. Thank you, Dr. Edwin. So I will do my best.
Thank you, and we know that you do that, and all our patients know that. They, when I have the video call appointments post off with my patients, they always say thank you to the anesthesiologist, Dr. Arceo, and the complete team, because well, you are, the patient is not alone. You're not alone. We all are a team that we will be working for you and taking the best option and decision. It is not only surgery. It is about a process for the rest of your life. Of course, always looking for a better life, a happier life, a healthier life, and you're not alone. Thank
Yeah,
you.
you're
Thank
not
you very
alone.
much.
And just to the last point is that because there, I forgot to tell this, because a patient, I remember that some patient told me, so you're gonna make me sleep and then you're gonna leave. No, okay. When we start with the anesthesia, we stay with you during all the surgery, okay, until you are to the recovery area. So we will never let you alone with the anesthesia, because we have to be taking care of you, of your heart, your blood pressure, if you any needs that the patient have during the surgery. So please, you can be sure that I'm gonna stay there with you during all the process. So that's, I want to finish with that. Okay.
Thank you. Thank you very much, Doctora. And see you
Thanks to you.
tomorrow
Gracias.
in the hospital. Gracias a todos por conectarse. Y estamos en comunicación en siguientes sesiones. We will be informing the next live, the next topics live. And have a good night.
Bye
Gracias,
bye.
Doctora.
Thank you,
Bye.
everyone. Gracias, doctor. Bye bye.